Come on, Sheila E. Yes, sir. With Heart and Soul of St. Louis, Mix 99.5 Mix Money Madness crew. That is Sheila E. talking about the glamorous life.
They want to lead it.
17 minutes after 7 o'clock. It is 30 out. High 42. Some sunshine today.
Yes.
That's what we need. Some sunshine around this piece.
And we got some in the office right now.
Do we really?
We got some sunshine in here.
Well, I mean, what you talking about?
I'm talking about Dr. Ebony January.
Yes, sir.
Good morning.
Every first Wednesday, she's going to hip you to the healthy. Last week, it was hyperthyroid. Last month. Thank you.
There you go. No, it's all good.
Sir. Hyperthyroidism and hypothyroidism.
Absolutely.
But this month, it's cervical cancer and pap smears.
That's right.
Absolutely.
Talk about it. Now, this you know firsthand.
Yes, because this is what I do. Yeah, this is exactly what I do.
That's
so
what's happening.
It's so important. The one thing that I always say when women come in and say they come in for their annuals, and so they're like, okay, I'm ready for my pap smear.
Right.
But the fact of the matter is, not every annual exam encompasses a pap smear. So that's one of the things that I wanted to educate a lot of people on, how often they should be getting screening and what is a pap smear versus what is a pelvic exam. So right off the bat is that a pap smear is not equivalent to a pelvic exam. A pelvic exam is just that us actually examining the pelvis, right?
Okay.
So Encompass is us taking a visualization of what actually the woman looks like down below.
Okay.
The pap smear itself is looking for cervical cancer. We take this little brush.
Okay.
And we take a sample of the cells of the cervix to send it off to the pathologist to look for precancerous lesions, or cancer, right?
Gotcha.
So that's the one thing, because many women will come in and say, oh, I had a pap smear in the ER. And I'm like, they're doing a pap smear in the ER, they're taking my job. So I have to, the one thing that I do is set that foundation and say,
Gotcha.
okay, a pap smear is not equivalent to a pelvic exam, and you don't need a pap smear every single year. So that's the one thing that I like to educate. No, you don't. So when women come in for their pap smears should start at the age of 21.
Okay.
Back in the day, it used to be when women became sexually active,
Gotcha.
but now it's age 21.
Okay.
So at age 21 to 29, young women should
Let me
have.
ask you this. Now, you said it's supposed to start when you're sexually active.
Not sexually active. Age 21.
Got you.
Age 21. It used to be sexually active. Now it is age 21.
Absolutely.
That's when women should have pap smears.
Okay.
21 to 29, they should have pap smears every 3 years.
Really?
Yes.
Okay.
After 29, so 30 years and up, 30 years to really age 65, they can have pap smears every 3 to 5 years, depending on the type of testing. So there are two different types of testing, right? You have something called just flat out cytology, where we're looking at the actual cells. Cytology, the root word meaning cells. And then there is co-testing, where we are testing we're testing the cells and HPV, the human papilloma virus.
Oh, absolutely.
Which is running rampant in black community.
Exactly. So that's good. So another thing that I like to educate young women on is the human papilloma virus, or the HPV virus. So that's the number one really risk factor for cervical cancer. Right? So that's why the human papilloma virus is so important. And there are many different types of the human papilloma virus. Some cause warts in the anogenital area, and then some cause abnormal pap smears. So the types that cause abnormal pap smears is type 16 and 18. There are other types, but those are the main two types that cause abnormal pap smears, which lead to cancer. The other risk factor for cervical cancer is smoking.
Really?
Yes.
Cervical?
So it can, if you have the human papilloma virus, a high risk type, there are low risk types, high risk types. If you have one of the high risk types and you smoke, it can accelerate your precancerous lesion.
But you can see that when you do
the cells, right? When you do the actual pap smear. So it's one of those things. So, and then when the results come back, there are many different types of interpretations, and so the interpretation itself tells us what we need to do next.
Now let me ask you this: how do you get the HPV? HPV. I can't even say it.
HPV.
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 Tongue twister.
Yeah.
So how do you get that? How do you?
Just being sexually active.
Got you. Okay.
So being sexually active is what causes the human papilloma virus.
Got you.
And so just to back up.
Papilloma virus. Okay.
Look at you. We're gonna work on it.
Yeah, we'll work on it.
He said human Apollonia.
The Papillonia. Apollonia.
Yeah, Apollonia.
Like that was a singing group. That was a singing group.
It was a lady.
Yeah. So, but it was a lady.
No, I'm sorry. Okay, so that's okay. So being sexually active. Okay.
Right. So being sexually active, which is why we no longer do pap smears under the age of 21, is because most young women will get the human papilloma virus.
They will.
They will get it, but their immune system will clear it. So what happens when we test women too much, we lead to over-diagnosis. And so what we do over-diagnosis is we start doing things which can cause other things. And so when your immune system can just flat out clear it.
Right.
Yeah, and so on average, young women will clear it in 8 to 24 months.
Wow.
Now, can I ask a question?
Absolutely.
Yes. What can we do what can the ladies do, of course, to do some proactive things to have a really good pap smear when they come in?
To have a really good pap smear.
Yeah, right. Like a very positive outcome on their cervical
So
exam.
just
Like,
actually trying to alleviate the risk factors. That's a good question.
Smoking.
Right. So smoking.
Okay.
Smoking is like huge.
No smoking nothing.
Well, cigarettes.
Okay, cigarettes. Okay.
We're just talking about nicotine.
All right, I got you. I got you.
Talking about THC.
All right, I'm just trying to clear it up.
Right. So it's mostly nicotine which
like,
causes.
yes,
I can smoke cigarettes, but I can't. I'm not saying that. I'm just saying cigarettes is
You know
what
you're
can.
saying, doctor.
I got you.
Right. And so just many women who have multiple sexual partners will can get HPV a little bit more, and it can persist. Meaning
So
it
keep
can
your numbers down, ladies.
Right. Keep your numbers down.
Keep your numbers down.
And condoms can help.
Okay, condoms do help. I was going to ask you.
Condoms can help.
Okay.
Yeah.
Cool. Keep
So
your numbers down and be safe.
Yeah, those
Be safe, basically.
Both.
Be safe out there.
And stay away from the squirrers.
Yeah, stop
as they
smoking
call
the
them.
Newports and the
Squirrers.
Yes.
No more Benson Hedges.
Benson the Hedges.
Cigarettes.
My grandma used to smoke those.
What, those Moors? The long skinny ones? The Moors?
I guess it was sexy.
Yeah, green.
Yeah.
Right.
Yeah,
they come in a
yeah.
little pack.
And
like,
ladies always had them on the tip of their fingers. Why did you put the Moor on the tip of your fingers, ladies?
just the very
my
tip.
God.
Just the very
Oh,
tip.
my God. Dude, that is, okay, that is
We
hard.
digressing. We go
Right.
from the Dr. Ebony January, OBGYN, doing her thing. Is it doctor with a DOCTOR?
EJ.com. That's right.
beautiful.
That's right. So yeah, it's very important, for cervical cancer for women to know.
Okay.
And not a lot of women know, like I said, the difference between a pelvic, a pap smear, and how often they should get them, because many people are still shocked that they're not getting them every single year.
So
they're like, what?
Pelvic exam, how often are you supposed to get that?
You should get that every year. That's a part of the
Every year.
annual exam. Absolutely.
Gotcha.
That's
Okay.
a great question.
So the pap smear is every 3 to 5 after
30, age 30.
No.
And 21 to 29 is every 3 years.
Every 3 years. So pelvic, you start that at 21 too.
Well, the pelvic exam is a little different.
Right.
So pelvic exam, many women will start that when they do become sexually active.
Got you.
But the thought is that you don't necessarily have to do a pelvic exam on someone who's under the age of 18 unless they got some stuff going on.
Got you.
Because many young women aren't necessarily comfortable.
Got you.
So we should be doing STD testing.
Right.
But
Right.
but we can do it other ways other than a pelvic exam.
They
So
do
we can
blood
test it
and
off the
urine.
urine. So off of the urine.
Got you.
Yeah.
Got you.
But 21, you really go ahead and
Yeah, just
get in the stirrups. Ladies, and let's
Seriously,
get this fixed.
get in the stirrups.
This dude. I mean, they have to bring the stirrup
Get in the stirrups. I'm glad that you know what a stirrup is.
I know. I think all men do it. Well,
Yes.
not all men, but
Yeah.
a lot of men do. We know what that is.
Yeah.
Of course.
Actually, we have a
It's
little
very
joke for it, but we're gonna need
Not here.
Yeah.
We're not gonna do it now.
I don't even know the joke, but we know we ain't going to do it here.
We're not doing any pap smears in this
All right,
video.
anyway, we're gonna keep it moving. We're gonna come back. We're gonna talk about some more.
Why not?
Yeah,
Why not?
We're gonna talk about-
absolutely.
Okay, in the next 8 minutes, we're gonna come right back. We're gonna recap.
Yeah,
Recap. And then we'll talk about the Gardasil vaccination briefly. It's very
We
important.
do that. Okay,
Yeah.
cool. Right now, we're about to get into this Earth, Wind, and Fire. It's called Devotions. Listen to the heart. Oh, I done turned off the wrong thing. Hit the wrong button there.
That's okay.
Okay. Let's keep it moving. 6:25, y'all.
Oh, good job.
Great job.
Strong.
Stirrups. Look at you coming through with the
Right, I'm
stirrups.
like, dude, seriously, we
You
gotta
gotta
do
get
this.
If Buddha was here, he'd be proud of me.
Oh, yeah.
Oh, the stirrups.
So ladies, get in the stirrups.
Get in the stirrups.
You know somebody was driving the lap.
Exactly. Cool. You probably caused a couple accidents with that. Oh, get in the
I should get
stirrups.
some response. I text those saying, say, man, you listening? You better wake up. Unless he had an event last night.
So I'm trying to figure out who all won these different elections. I know quite a few people were running
Oh, yeah.
for different positions. I know Jason won. Clayton.
Was Frank's wife running?
Frank who?
Bruce Franks' wife. The wife's
I'm not
name,
sure.
Diana Frank. She running